Hi, I'm Nina,
And I'm Simay.
and we will be presenting on the infectious disease of swine flu. The topics we will be covering are the cause, the method of transmission, the effect on the body or the symptoms, the social implications of the disease, possible treatments, and basic background and history of the disease. So to start off, another name for swine flu is H1N1, and this is a type of virus, meaning that it cannot be cured through antibiotics because it doesn't have a metabolism like bacteria do. It is caused by a strain of influenza virus that usually only affects pigs, which is swine. That's where the name came from. Influenza means highly contagious viral infection of the respiratory passages. The method of transmission, it is highly contagious. So if a person has it, they can easily transmit it to another person. But if pigs have it, it cannot be passed from pigs to people. It spreads the same way as any common cold and seasonal flu. So if you cough or you sneeze, it brings tiny drops of the virus into the air. If you come in contact with these drops, you may become infected. Or after these drops hang in the air, usually for about 30 seconds, then they drop and on surfaces. So for example, on handrails, sinks, doorknobs, computer keyboards, and there they can live up to 24 hours. So if you touch that, then you can also become infected. Yes, so the effect on the body or the symptoms are the same as a common cold. So cough, fever, sore throat, fatigue, chills, stuffy or runny nose, body aches, headaches, and it can lead to more serious problems like pneumonia and respiratory failure, and it can make diabetes and asthma worse. So as you can see, it definitely affects the respiratory system. In adults, we also have sudden dizziness, confusion, vomiting, lower temperatures, and pain or pressure in the chest or abdomen. And then for children, it's common for them to have a bluish skin color, not drinking enough fluids, not waking up or not interacting, feeling dull, being unable to eat, having no tears when crying, and just a few other flu-like symptoms. Now for the social implications of the disease. Americans had higher casualty rates than any other country in the world, 20% higher in fact. Countries such as Europe had lower death rates. This is because Europe is more developed, and so people have access to soap daily. And so the higher your class, basically the better off you are, since you can protect yourself, stay hygienic and stuff. And the death rates are the highest in Africa and Southeast Asia, and these are poorer nations. And they lack the facilities, or a lot of them do not have soap to wash their hands with before and after dinner, and just throughout the day. So that are some social implications.
Or they don't even eat enough food in many of those underdeveloped countries, so they don't have the adequate immune system to fight off this disease, so they can easily catch it. So possible treatments of this disease are for those that are at risk. There's a vaccination available that you can get annually, but it's only at certain ages that you can get it. Or those over the age of 18 can get them, including everyone over 65. And children aged from 6 months to 2 years who are at risk of flu can also get this vaccination. The flu vaccine is also given as an annual nasal spray to children aged 2 to 18 years at risk of flu, and healthy children aged 2, 3, and 4. So possible cures, not really cures, but treatments of the disease that will not completely cure the disease, but reduce the symptoms are the people that are infected are suggested to stay stay and rest at home, stay in a warm environment, drink water consistently to prevent dehydration. Paracetamol or ibuprofen is available and helps to lower high temperature and relieve aches, to help relieve symptoms and possibly reduce the risk of serious complications. Medications such as Tamiflu and Relanza are also available, and antibiotics help to fight bacterial infections such as pneumonia may occur as a complication of the influenza. But it is important to record that these antibiotics are not to fight off swine flu itself, as it cannot be treated through antibiotics, but the complications that occur as a result of
lessened. Yeah. Also, ways to prevent swine flu are just the basic hygiene things. So always wash your hands. If you touch a dirty surface before touching your face, you should wash your hands. Things like that to make sure that you are clean and you don't pass on the germs to others.
Just like normal flu things that how you prevent catching a normal flu, as it is passed on the same way. So swine flu was first detected in April 2009 and was referred to as the Mexican flu when it was first identified, because it was identified in Mexico. The flu was later on named to be swine flu because, as Nina said, the flu was a normal influenza that caused illnesses in pigs. When its initial periods of presence, it could spread rapidly from country to country because people were not aware of it. It was seen when people caught it, it was seen as just a normal flu, so people didn't take it seriously. And since it hadn't been around before, people didn't have the immune to it, so they could easily capture this flu. Most reported cases were mild. However, a small number of cases ended in death of the infected individuals. These were mostly elderly people, very young, pregnant women, or people with a pre-existing health condition such as cancer. So obviously, these are the people that have their immune systems not weakened for some reason, whether it's age or pregnancy or other health conditions.
So that was our presentation. This is our bibliography, and if you just scroll up, we have 2 photos of the virus through micrographs. So that's the virus, that's the influenza virus, and there are 2 types, A and B, and this is the A virus.
That one?
Yeah, both of them.
Oh, well, these are both
The same.
A parts. And yeah, that's all.
Thank you.
Thanks for watching. Let me just end up the bibliography if someone wants to see it.
Yep.
Yeah.